Good day. My name is Fayoke Patade. I am happy to present to you my DMP Quality Improvement Project that was conducted during my time at Fairfield University. This QI project explored the impact of visual cues in improving perioperative hand hygiene compliance in the perioperative setting. This project was conducted in an acute care hospital on a unit that is a collaboration between Hospital for Special Surgery and Stanford Health. The unit where the project was conducted specializes only in orthopedic and spine surgeries. In perioperative specialty, there is a high focus on quality, surgical antisepsis, and hand hygiene, but it is mostly from the perspective of the scrub personnel. While the AORN, Association of Perioperative Nursing, has published guidelines for hand hygiene on both the scrubbed and non-scrubbed role, there remains little to no focus on the non-scrubbed personnel. In 2019, the WHO, World Health Organization, identified the 5 moments of hand hygiene for clinical practice, but its applicability to the operating room was only recently explored in research studies outside of the United States. It is important to note that there are no tools available that applies the 5 moments of hand hygiene to the perioperative services. Hand hygiene compliance is set to decrease surgical site infections and other hospital-acquired infections. Evidence and literature supports that an increase in hand hygiene compliance can be achieved with a combination of interventions. The purpose of this quality improvement project is to determine whether visual cues increases hand hygiene compliance in non-scrub members at an acute care orthopedic operating room. For this project, the non-scrub personnel consists of or is defined as the anesthesiologist, circulating nurse or facilitating nurse, NTAC, the physician assistants, the surgeon, prior to scrubbing in only, and the assistive personnel such as the unit aide or OR aide or anesthesia technicians. So compliance data was collected using an audit tool and was collected by an independent anonymous observer who recorded incidents of hand hygiene, observed incidents of hand hygiene, according to the WHO's 5 moments of hand hygiene. The 5 moments of hand hygiene are defined as criteria 1, upon entry into the OR, criteria 2, before an assessment or procedure, criteria 3, after an assessment or procedure, criteria 4, after exiting the operating room, and 5, after contact with the patient surrounding. Literature supports the applicability of the 4 moments out of 5 to the operating room, but the 5th moment is undetermined in literature. For this project, the 5th moment was clearly defined with the team and is included in the data that was collected and gathered. It was defined during the educational phase of the intervention and monitored all through. Using the Plan, Do, Study, Act theoretical framework, hand hygiene compliance was monitored over 6 months. Statistical analysis was found that the operating room assistant personnel or assistive personnel, which comprised of the ORAs and anesthesia techs, and registered nurses had greater odds of intervention association on hand hygiene compliance than the surgical team in all criteria except for criteria 2. Now, remember, criteria 2 is before invasive procedures. This was with statistical significance. When comparing post-intervention data to baseline data or pre-intervention data, criteria 2, that's the criteria that applies to hand hygiene compliance before invasive procedure, there was statistically significant finding with a P of 0.004 in hand hygiene compliance for all individuals monitored. So it can be concluded that the combination of education and visual cues prove to be most effective in increasing hand hygiene compliance. However, a sustained compliance rate would require leadership involvement and a focus on accountability amongst team members. So these findings were consistent with literature in what it takes to make a change in the culture and sustain hand hygiene compliance or practices in your areas. Thank you so much for taking the time to listen to this presentation. I hope you found it enriching. Please feel free to reach out to me with questions. Have a good day.